My name is Dr. Jane Drobin, and I am one of the doctors at Turnpaugh Health and Wellness. A few weeks ago, I had the pleasure of doing a health talk at the Women's Expo. Here it is for those of you that missed it. So, just a few formalities. Yes, I'm a doctor, but I am not your doctor. So, if you hear something you want to try or something you want to learn more about, please talk to your healthcare provider. So, I am a functional medicine doctor, and functional medicine is a branch of medicine that looks at the root cause of disease. We want to know not only what is happening, but why. So, why do I care? These are the things that I hear weekly. My doctor said my labs are normal, but I feel terrible. My doctor said painful periods are normal. My doctor said birth control is my only option. My doctor said it's just menopause. Get used to it. My doctor said it's pointless to test my hormones because they change daily. My doctor told me to not be concerned with 2 miscarriages. Wait for the third one. Hearing these statements makes me so sad because healthcare needs to be better than that. As I was putting this together, I realized I could easily spend an hour per topic. So here I am to do my best and really highlight some of the key points. PCOS, polycystic ovarian syndrome. Syndrome meaning it's a spectrum. You can have 10 people with PCOS and all 10 have a different treatment approach because we need to figure out what is driving that PCOS. This is the most common endocrine disorder in reproductive aged women and is the most common cause of infertility in women. Diagnosis is based on the Rotterdam criteria, meaning you need 2 out of the 3 following: irregular cycles, hyperandrogenism, and polycystic ovaries found in ultrasound. More recently, they have updated the Rotterdam criteria, so you no longer need to have polycystic ovaries on ultrasound, but you do need an elevated AMH, which is anti-Müllerian hormone. Sometimes patients say to me that their doctor stated they don't look like they have PCOS. Well, if you look at their criteria, BMI is not something that is considered. So there is something called lean PCOS. Now, labs are very individualized per person, but in general, these are the things that I'm looking at for PCOS. I'm always running a full thyroid panel, which I'm going to talk about that in the future slides. I'm always running a fasting insulin, glucose, hemoglobin A1C. I'm checking out ANA, which is looking at autoimmunity, cortisol, liver, inflammation, cardiovascular. I'm testing your luteinizing hormone and your follicular stimulating hormone, which is pretty much is your brain talking to your ovaries. I'm checking out your estrogens, androgens, AMH, your CBC, iron, ferritin, omegas, vitamin D, B vitamins, prolactin, and I assess for leaky gut through a history. Now, there is a difference between a normal lab range and a functional range. A normal lab range for insulin, for example, could be 0 to 24. So sometimes patients will say to me, my insulin is 17. That means it's good. And I say, well, not necessarily. For me personally, I like to see a fasting insulin at 5. Now, functional lab ranges are ranges you need not only to survive, but to thrive. And realistically, most lab values do have a functional range. For example, vitamin D should be around 60 to 80, your B12 should be around 750 or higher, and your TSH should be about 1.5 to 2.5. So treatment is really based on what is fueling the PCOS. And sometimes patients ask me, do I really need to treat PCOS if I don't want children? Well, the answer is yes. It's fine that you don't want children, but you still have to look at your hormones. I personally think having a healthy menstrual cycle is just like a vital sign. Plus, PCOS is not necessarily a gynecological issue, but an endocrine issue. Then we talk about lifestyle changes. So really upping that protein, decreasing those carbohydrates. If someone is weighing about 150 pounds, they should really be aiming to get about 40 grams of protein per meal. I discussed the elimination of inflammatory foods. This does include things like gluten, dairy, corn, soy, sugar. Gluten can cause inflammation, which can cause leaky gut. And my beef with dairy, no pun intended, is that it's filled with hormones, which can cause an insulin surge of 3 to 6-fold. And it's filled with insulin growth factor, which can cause weight gain, which is great for baby cows, but not necessarily great for someone who wants to lose weight. I'm going to talk about exercise in the future slides. And of course, don't be afraid of fruit. I find that sometimes patients say they're not allowed to have fruit because they have higher levels of insulin or glucose. And I don't necessarily always agree with that because fruit is also filled with other things like quercetin, vitamin C. So that can really help stabilize that blood sugar. So you probably should avoid the Skittles, but go ahead and eat that apple. Toxins, I'm going to talk about that future, and pretty much just avoid endocrine disruptors. And kind of coming back to dairy, I know some of you might have been thinking, okay, well, if I'm not going to have my dairy, how will I get my calcium? And the answer really is from whole foods. You can eat sardines, kale, almonds, spinach, and broccoli. Thyroid. So there's hyperthyroidism and hypothyroidism. Hyperthyroidism symptoms could include weight loss, increased appetite, heat intolerance, diarrhea, tachycardia, anxiety, increased sweating, sometimes increased hair growth. Symptoms of hypothyroidism could include weight gain, decreased appetite, cold intolerance, bradycardia, constipation, fatigue, depression, brain fog, hair loss, thin nails, and dry skin. Today I'm going to talk more about hypothyroidism. So 90% of those with hypothyroidism actually have something called Hashimoto's disease. When I talk about Hashimoto's, I explain that you are now going from an underfunctioning thyroid, which is what hypothyroidism is, to now an autoimmune disease. And I reach into my drawer and I pull out this little Venn diagram, which can really be applied to most autoimmune issues, such as like rheumatoid arthritis, psoriasis. And I say that genetics do have a part into this. So you can thank your mom and dad for that. And then we look at intestinal permeability and immune dysregulation, which is a fancy way of saying leaky gut. And lastly, we look at a trigger, things like mold, Lyme, viruses, stress, pesticides, heavy metals, toxins, pregnancy. It's when you have the perfect storm of all of these three things together, this can lead to an autoimmune issue, which does not just happen overnight. Now, when autoimmunity is triggered by trauma or stress, that is something that you need to work through. Dr. Sarah Gottfried has a new book called The Autoimmune Cure, and she does a really good job going in depth about this. Remember, the body does keep score, and trauma leaves a signature. This is what I would consider a full thyroid panel. The stuff in red is what your normal allopathic doc is running. The stuff in bold was I'm typically running. And we always start with a TSH. That stands for thyroid stimulating hormone. Pretty much is your brain talking to your thyroid. Then your thyroid creates a hormone called T4, and then T4 turns into T3, which is your active thyroid hormone. And sometimes I test for reverse T3. This is pretty much looking, well, if it's elevated, you're asking yourself, is this person stressed? Is inflammation a concern? And if you're looking for that Hashimoto's diagnosis, your doctor should be testing your thyroid peroxidase and your thyroglobulin antibodies. There's also something called Graves' disease, which is the autoimmune version of hyperthyroidism. And in order to diagnose that, you should have something called thyroid stimulating immunoglobulin checked. You can have all three antibodies present for Graves' disease. Now, I had a patient a few years ago. She was a mom of three. She was in her mid-30s, and I had diagnosed her with Hashimoto's essentially. She had elevated thyroglobulin antibodies, but her thyroid still looked okay in the sense that her TSH, her T4, and T3 were not too off of the normal markers. So she did not need medication at this point. Now, she also had candida overgrowth, Lyme disease, and she had very low progesterone with high cortisol. So essentially, I treated her Lyme, I killed her candida, and I fixed her hormones, and she felt great. And 6 months later, we tested her thyroid, and essentially, her thyroid antibodies were gone. We were both very happy about it. Now, keep in mind, this is not always this simple. You know, the thing with Hashimoto's disease is you have to find, or really any autoimmune disease, is you have to find what is triggering it. And that can take a lot of work and a lot of effort when it comes to treatment. But it is a really great example that once you figure out what it is, you can really feel good and have that reflection shown on your labs. Now, my biggest advice with Hashimoto's is that you have to stop eating gluten. The body doesn't know the difference between gluten and your thyroid. So when you ingest it, your body starts to attack the thyroid. This is called molecular mimicry. Endometriosis is a painful condition in which the tissue that is similar to uterine tissue grows outside of the uterus. Main symptoms include extremely painful menstrual cycles, which you don't always have to have. Diagnosis includes ultrasound, MRI, could be laparoscopic. Treatment consists of surgery, pain management, and hormone therapy. Now, a lot of doctors have no idea why this happens. Some say it could be genetic. Some say it could be due to retrograde bleeding. I personally think that this is a mixture of an inflammatory disease with immune dysfunction. So, where do I start? Well, I treat the gut. There's something called microbial hypothesis, which pretty much looks at the gut and says, yeah, there's some dysbiosis, and research shows that those with endometriosis has 6 times more LPS in their endometrial cavity than those that don't have endo. LPS stands for lipopolysaccharide, which is essentially a toxin secreted by gram-negative bacteria. I'm also looking at hormones. I love to run something called the Dutch test, which really lets me see what is your estrogen doing? How much do we have? How is it being metabolized? What pathway is it going down? And I get a really good look at that phase 1 and phase 2 liver detoxification systems. We look at toxins, and I like to remind everyone that about 10% of those with endo actually do have a nickel allergy. And to the right, you'll see some foods that are high in nickel, but gluten is definitely one of them. So coming off of gluten can be extremely helpful. Adrenal fatigue. So your adrenals are these little triangular shaped glands on top of your kidneys. They help with metabolism, stress response, blood pressure. They produce hormones, cortisol, aldosterone, DHEA. Now, essentially, there are things like Cushing's and Addison's disease, which are diagnosable adrenal disorders, but they are not what I'm referring to when I talk about adrenal fatigue. Now, I use the word adrenal fatigue all the time, as I am sure many of my functional medicine colleagues do as well, but that is implying that the adrenals are literally fatigued and don't produce cortisol. Well, that's not necessarily accurate, as the brain tells the adrenals to produce cortisol. What we should be calling this is hypothalamic pituitary adrenal axis dysfunction, or HPA axis dysfunction, but that is a mouthful and nobody wants to type that onto Google. So when I talk about stress, I go back into that drawer of mine and I get out this little diagram. I want you to imagine a busy highway. I think of I-90 because I went to school in Chicago. And essentially this highway represents your body. And all of these little vehicles are a different function of your body. So the school bus to the left is essentially osteoblasts creating bone tissue. This little blue van to the right, that could be your cells absorbing, glucose. And what happens is that a big old ambulance, if it plops itself right in the middle of that highway, well, now these cars can't move. Ambulance is what resembles stress. So if this is happening like 1 to 2 minutes a day, not a huge problem. That ambulance is going to get out of the way and these cars are going to go on with their day. However, if that ambulance is stuck there for hours, for days, for weeks, these cars can't go anywhere. Essentially, your body can't do what it needs to do. So our body starts to suffer. And sometimes you feel fatigued, constipated, maybe your hair is falling out. It's because our HPA axis affects the circadian rhythm. And because most of our cells run on a circadian rhythm, this is why stress affects everything. Now, I love to give adaptogens to probably most of my patients. Adaptogens are pretty much herbs that give your adrenals one nice big hug. This includes things like rhodiola, ashwagandha, holy basil, schisandra, licorice root. But if someone is just giving you adaptogens, they're really only focusing on the A part of HPA axis and not the HP part. So the HP part is what's looking at the brain. So we have to discuss things like inflammation, circadian rhythm, perceived stress, glycemic index. You need to stop the source of the fire rather than spraying aimlessly at the hose. So let me go back to perceived stress. Our body does not know the difference between you physically running from a bear trying to save your life or you worrying about a fight with a spouse or worrying about a test that you may have. Our brain process these things the same way. So this is my cortisol from a few years ago. And this is after I had my first kiddo and she was pretty much sleeping through the night. So I decided I'm going to start waking up really early in the morning and going to the gym and kind of getting back into that routine. And when I would go to the gym, I would do HIIT workouts, I would do cardio. I wanted to sweat and I wanted it to feel like I did a workout. However, I was feeling like crap. And looking back at this, what was going on was that in the morning, you can see this little chart to the left, my cortisol is already elevated. So the things that I was doing was further elevating my cortisol, which was not helping me in any single way. And I definitely wasn't losing weight and I wasn't feeling good and I was actually really tired. So So what I should have done was either moved my workout towards the end of the day where my cortisol looked semi-human like, or if I wanted to continue to wake up in the morning, I should have been doing things like diaphragmatic breathing, stretching, yoga, Pilates, things that weren't going to completely wreck my cortisol. Now, there's three different ways to look at cortisol. You can look at it through blood work, and I don't find it super useful. More so in emergent situations, this can be looked at because it just tells you what's going on with your cortisol at like 9 o'clock in the morning. Well, what about the rest of the day? Next is the salivary cortisol. This is considered the gold standard, and it is usually covered by insurance, which is awesome. But this does not account for liver metabolism, thyroid function, and it looks at free cortisol, not free in total. This over here, this graph that we have over here is urinary cortisol, and these are looking at metabolites. This is my favorite way to look at cortisol, but unfortunately, insurance does not like to cover that. So 1 in 5 married couples are currently struggling with infertility. And I know that this is a women's health talk, but I have to talk about the man in this topic. So men are sometimes out of the equation, but they're actually half of the equation. So 1/3 of the time fertility issues are coming from the female, 1/3 of the time it's from the male, and 1/3 of the time it's from both of them. Now I test testosterone on a regular basis on pretty much all of my adult patients. And in the last 2 years, I've noticed such a decline in testosterone in men. It's actually very concerning and is a huge factor maybe why fertility rates are lower. For the record, they do make male prenatals. Now, as women, our ovaries are going to age, and we cannot change that. What is not normal, though, is the acceleration of ovarian aging and the loss of our ovarian reserve. Oxidative stress is the buildup of compounds that cause DNA damage, and things like a high sugar diet, toxins, inflammation, low antioxidants, chemical exposures can affect this. This can literally cause our ovaries to start aging or atrophy. So then we look at inflammation, and inflammation can come from many sources: food sensitivities, leaky gut, toxins, diets high in sugar, and this can affect endometrial receptivity, meaning you can be ovulating, having the perfect menstrual cycle every single month, but when that egg travels to the inflamed endometrium and the egg says, no, thank you, and it doesn't implant. It needs a healthy environment, which is why for a lot of my fertility patients, I always start with the gut as well. Now, with testing, this is pretty similar to some of the other tests that I've talked about earlier. I do want to bring light to two specific tests. Number one being iron. The iron oxygen delivery system is crucial as it helps deliver oxygen to our system. And as we age, we see a decrease in vascularization to our ovaries and really all of our tissues. So less vasculature with less oxygen coupled with low iron, this can make you struggle to get pregnant. I heard this in a podcast and I really loved it. And they had said that the health of a follicle is the function of capillary flow to the ovary. And that really stuck with me. That's why I encourage a lot of therapies like acupuncture, massage, chiropractic. Even if you're someone that's going through IVF and IUI, this is going to help with blood flow. I also like to look at methylation, and I like to test for MTHFR gene mutation. Now, I do think that MTHFR gene mutation is overblown, and I do think a lot of people have it. Now, I do pay extra attention to it when it comes to fertility and even those who suffer from miscarriages. Menopause is our second puberty, and I tell my patients that when their ovaries start to say goodbye, they pass the baton over to the adrenal glands. And now the adrenals have to do their job and now kind of take over some of this hormonal production. Some of the top symptoms include fatigue, brain fog, memory loss, anxiety, sleep issues, joint pain, lack of focus, hot flashes, decreased libido, lack of patience, low metabolism, and change of body shape. Now, 50% of these are actually cognitive symptoms. I cannot tell you how many times patients will come up to me and say, Dr. Drobin, I think I have Alzheimer's. I think I have dementia. And I say, no, you are perimenopausal or menopausal. Realistically, there's over 100 different symptoms and even weird things like phantom smells, electric shocks through your arms. And I love what Dr. Anna Kabecka had said. Menopause is mandatory, but suffering is optional. Now, perimenopause can start as early as your mid to late 30s. So if you are still cycling, most of these labs can be done on day 3 to 5 of your cycle. Now, some specific labs like progesterone should be tested around days 19 to 22. If you are in menopause, then labs can be done whenever. To be considered menopausal, You do need to have 12 consecutive months with no period. And if you do bleed on month 11 and day 17, you have to start all over. So these are the labs I'm typically running. Again, this is really going to change per person. But something that I do want to specifically discuss is getting an in-depth cardiovascular panel. As our estrogen starts to go down, heart disease starts to go up. So, two big complaints that I hear during menopause is I can't sleep and my anxiety is through the roof. So, what happens is that progesterone is the last hormone to come during puberty and the first hormone to peace out during menopause or perimenopause. So, progesterone works on GABA and GABA helps us sleep. So, now sleep becomes a problem. Again, once progesterone starts to decline, estrogen is left unchecked. So now we are anxious. This happens because we have heightened levels of estrogen comparatively. And because estrogen and dopamine look similar, these are circular shapes. We call these phenolic compounds. They get metabolized in a very similar fashion. So this can cause increased levels of dopamine by threefold. So we might not necessarily be depressed, but we're definitely a little more anxious and less resilient to stress. So tips for menopause: get plenty of protein, fiber, and fat. Protein is going to help with lean body mass and satiety. You want to maintain your muscle mass. Your muscles are your metabolic spanks. They keep it all in for us. And once we hit the age 30, we can lose about 1% of muscle mass a year. And then once we hit the age of 40, we can start to lose 2 to 5% of muscle strength a year. So strength training is vital. You can use things like herbs, bioidentical hormones, adrenal support, which I talked about earlier. You have to balance your blood sugar. One of the keys to balancing your hormones is having a healthy blood sugar. You have to sleep. You might want to consider avoiding sugar, alcohol, coffee. You ask yourself, is that glass of wine worth a whole night of hot flashes? And sometimes I have women come up to me and they say, I haven't changed a thing. I'm eating the same, I'm exercising the same, but I'm up 10 pounds and it's not coming off. You have to remember, what worked for you in the past or maybe the last decade doesn't mean it's going to work for you again. We have to talk about stress response. So, positive emotions. Your body is listening to your thoughts, so please be nice to yourself. And of course, quieting down that brain chatter that we have on a regular basis. You have to let your brain relax, even if it's just for 20 minutes a day. Grab some maybe essential oils, put on some really nice music, stop thinking about your to-do list, and just relax, which is really hard to do. So let's talk about environmental toxicology. So there are chemicals everywhere, and this is just the smallest of things you should start thinking about. But on average, a woman is exposed to 500 different chemicals before they leave their house in the morning. Men are exposed to about 350. And as you're looking at the list and you're wondering, how am I going to make this changes? You have to consider, start with one thing a month. You change one thing a month, in a few years, you're going to have a completely different environment that you're living in. And sometimes people say to me, well, what's the point? Well, if you have the option of walking into a room where there's 11 people smoking or 3 people smoking, you're probably going to pick the room with 3 people smoking because it's a less of a toxic load to you. So let's look at the list. First and foremost, if you can't pronounce something, if there's an ingredient that you don't know what it is, or maybe the ingredient has a bunch of numbers, you probably shouldn't be ingesting it. You probably shouldn't be putting it on your skin. Remember, your skin is the largest organ of your body, and it does absorb a lot of things. So that's where your soaps and shampoos come into place. Get rid of that nonstick cookware. Deodorant, get rid of the aluminum. I love the brand Native. Look at your cleaning supplies. I really like the brand Branch Basics. Look at your baby stuff, your car seats, your baby toys. They are filled with plastic. Why are we starting to poison our kids with endocrine disruptors at such a young age? Look at your makeup, your food. Pesticides are everywhere. Your EMF exposure, radon. If you live in Pennsylvania, you have radon in your basement. Get it tested. You can't necessarily smell it, but it's there. Tupperware, switch to Pyrex. Plastic water bottles, not great for us. I'm sorry to our Stanley Cup lovers, but there is lead in there. Get rid of your Starbucks cups. Every time you're drinking that nice cup of hot coffee with that plastic lid on top, you have a cup of coffee filled with plastic. When you go to the grocery store and they hand you that receipt, ask them to put it in your bag. Clothes, specifically workout pants, they are filled with plastic. And then when you're sweating and hot, you're just absorbing all of that. Clean feminine products. So if you can just get an organic pad, an organic tampon, you've already decreased your absorption of chemicals. I've had women's pelvic pain go away just by getting clean feminine products. Dirty electric, mold, fluoride, aluminum foil, your water source. You can go to the EWG.org app, EWG.org website, and you can type in your zip code and see what type of water is in your area. Pesticides, VOCs, nail polish, hair dyes, sunscreen lotions, candles, silver fillings, canned foods, all these things can potentially have a problem. There's about 84,000 different chemicals out there. How many do you think have actually been tested? 1%. And there was a study that came out a few years ago. 287 toxic chemicals were found in the average umbilical cord. That is not good. So now that I've freaked you all out with the chemicals, I love ending my talks with a quote. So to control your hormones is to control your life. So I encourage all of you to take control of your life.